My name is Dr. Arthur Hartman. I am 63 years old. I spent my entire career in emergency medicine. I have seen things in the ER that still keep me awake at night. But there is one specific emergency that breaks my heart more than any other, because it is almost always completely preventable. And I spent years not knowing how to properly teach my older patients how to survive it. Let me tell you what happens. Imagine you are alone in your kitchen. The house is completely quiet. You take one normal bite of your dinner. It is nothing unusual. But suddenly the food stops halfway down your throat. You try to cough. No air moves at all. You try again. Still nothing. Your chest tightens up. Your hands instinctively grab your neck, and the terrifying realization hits you hard. No sound is coming out. You look around the room. There is no one there to help you. Your phone is sitting all the way across the counter. Your lungs are desperately trying to pull in air, but the airway is completely blocked shut. Within seconds, your body starts to panic. Your heart races. Your vision begins to narrow. Every single second feels longer than the one before it. I need you to know that this is not rare. In the United States alone, more than 50,000 people die from choking every single year. I have pronounced too many of them dead myself. A massive portion of those deaths happened to adults over 60 who were completely alone at the exact moment it happened. There were no witnesses. There was no help. It was just a silent, terrifying emergency unfolding in a normal kitchen or a living room. You see, after 60, choking becomes much more dangerous, for reasons most people never even think about. Your swallowing muscles physically weaken. Your saliva becomes thinner. Certain daily medications severely dry out your throat. Most of my patients believed that choking was impossible to survive if they were alone. They imagined the Heimlich maneuver required another strong person to stand behind them. But I am telling you today that belief is not entirely true. I learned that there are specific techniques that can create the exact same pressure using your own body. Simple actions can force air upward and push the obstruction right out. In this video, I am going to reveal 7 life-saving techniques every senior should know to survive choking alone. I have ranked them from least powerful to most powerful. And number 3 is a method many people never hear about until it is way too late. It can create enough pressure to clear your airway even when there is no one else in the house. I have placed practical guidance notes in the description if you want to review them later. Before we dive in, let me ask you a quick question. Are you watching this video alone right now? And how old are you? Tell me in the comments below. I read through them myself and I respond whenever I can. Now let's begin with tip number 7. This is the first action that can buy you precious seconds when your airway suddenly closes. Number 7. Stop moving and force yourself to stay completely calm. I know this might sound completely counterintuitive. Your body is literally screaming for oxygen. But the absolute first thing you must do the instant you realize food is stuck in your airway is stop everything. You must fight the overwhelming urge to panic. This is your first action step, and honestly, it is non-negotiable. I read a detailed study from researchers at the University of Michigan Medical Center. They looked at emergency choking incidents. They found that patients who panicked and began flailing around or running wildly through their home actually caused the food obstruction to lodge itself much deeper into the airway in nearly 30% of cases. When your brain senses the oxygen supply is being cut off, it immediately floods your entire system with massive amounts of adrenaline and cortisol. It triggers a powerful fight or flight response. That response makes every single muscle in your body tense up hard, and that includes the critical muscles surrounding your throat. That is the exact opposite of what you need right now. Panic also causes you to gasp inward sharply and involuntarily. That sudden, desperate inhale can actually pull the food object further down into your trachea. It turns what might have been a partial blockage into a complete and far more dangerous one. What you want to do instead in those first critical seconds is stop moving entirely. Recognize clearly what is happening to you. Mentally tell yourself with absolute conviction that you know exactly what to do next. Emergency medicine specialists at Stanford University specifically recommend developing what they call a mental anchor phrase. It is something short and powerful like, "I know the steps," or "I trained for this." You practice saying it to yourself ahead of time so it becomes completely automatic under extreme stress. Think of it exactly like the muscle memory that airline pilots develop for emergencies. Pilots do not enjoy thinking about engine failures, but they rehearse their emergency responses so many times that the correct actions override their panic completely when the real situation hits. The exact same psychological principle applies to you right here in your kitchen. If you live alone, practicing this mental reset exercise just once a week while sitting quietly at your dining table can create the neural pathway in your brain. It will activate instantly when a real choking emergency occurs. The calmer you force yourself to remain, the more oxygen your body conserves from whatever air is still trapped in your lungs. That conservation buys you precious extra seconds to execute the physical techniques coming next on this list. Staying calm is your foundation, but now you need to get a signal out fast. Before we move forward, please give this video a like and subscribe. What's ahead could change everything for your health. Number 6. Grab your phone and dial emergency services right now. The very moment you have taken that mental breath to steady yourself, your immediate next action is to grab your phone and dial 911. You must do this even though you almost certainly cannot speak a single word right now. Most people skip this step entirely. They assume calling for help means having a clear conversation on the phone, but that is absolutely not what this is about. Understanding that difference could literally save your life. If you have a smartphone within arm's reach, dial your emergency number and just leave the line completely open. Do not hang up. Professional dispatchers are specifically trained to send emergency responders when they hear any sounds of distress. They listen for choking, gagging, struggling, or even total silence from an open incoming line. Modern emergency dispatch centers across the country now use enhanced 911 tracking systems. They can locate your exact position from your cell phone signal with remarkable accuracy. So even if you cannot utter a single syllable of your address, the paramedics can still be directed straight to your front door. If you wear a medical alert pendant or a wristband, and frankly, every single senior living alone should absolutely have one of these devices, press that emergency button immediately. It takes exactly 1 second. It instantly connects you to a professional monitoring center that will dispatch paramedics to your registered home address without you needing to say anything at all. The American Heart Association has publicly recommended that seniors who live alone should keep their phone physically accessible during every single meal. I tell my patients this every day. Do not leave it sitting across the kitchen charging on the counter. Do not leave it in the bedroom on the nightstand. Keep it right there next to your plate every single time you eat. Researchers in Boston conducted an analysis of choking fatality cases among elderly patients. They discovered something tragic. In the overwhelming majority of deaths among seniors living alone, a working phone was present somewhere in the home. It was just simply not within arm's reach of where the person had been eating when the choking began. You should also know that banging loudly and rhythmically on a shared wall or the floor works surprisingly well if you live in an apartment building. Neighbors will absolutely investigate persistent, unusual pounding sounds. The essential point to understand here is that calling for help and saving yourself physically are not mutually exclusive actions. You must do both simultaneously, and you can do both. Getting that emergency call activated means professional backup is racing toward you while you work through the remaining self-rescue steps. Help is now on its way to you, so get your body into the correct rescue position immediately. Number 5. Stand up straight and lean your whole upper body forward. Once you have successfully triggered some form of external alert, your very next physical movement should be to push yourself up to a standing position if you are seated. Then, Lean your entire upper body forward at roughly a 45-degree angle. Let your head point down toward the floor. This specific positioning is not random advice I found on the internet. It is based on fundamental physics principles and detailed airway anatomy research. I have seen it validated repeatedly. When you remain sitting upright in your dining chair, or worse, when you lean backward against the chair back in a panic, gravity is actively working against you. It helps the food obstruction settle deeper and more firmly into your airway passage. But the moment you lean your torso forward and let your head drop, gravity completely shifts. It becomes your ally. It begins gently pulling the stuck object back toward your mouth opening, instead of letting it travel further down into your trachea. A detailed clinical study published in the journal Resuscitation measured the effectiveness of different body positions during choking emergencies. They found that maintaining a forward-leaning posture increased the success rate of subsequent cough attempts and abdominal thrusts by up to a full 25% compared to patients who remained seated upright. Airway specialists at the Cleveland Clinic explained this clearly. The angle of your trachea relative to the gravitational pull changes dramatically when you tilt your upper body forward. It essentially transforms your throat from an upward-facing tube that traps objects into a downward-facing tube that encourages objects to slide back out. If you absolutely cannot stand up due to mobility limitations, chronic pain, or balance issues, then scoot yourself forward to the very edge of your chair seat. Bend at the waist as far forward as you possibly and safely can. Let your head drop well below the level of your chest while gripping the table edge firmly for stability. This positioning also significantly opens up the physical space between your diaphragm and your throat. It gives your lungs substantially more room to generate the powerful burst of compressed air pressure that you are absolutely going to need for the more forceful techniques coming next in our countdown. Your body is positioned perfectly now. It is time to use your lungs as a weapon. Number 4, cough as hard and as deliberately as you possibly can. Your body's own built-in natural defense mechanism against airway obstruction is the cough reflex. And if you currently have any air moving at all through your throat, meaning you can produce even the slightest wheezing sound or thin squeaking noise, then your airway is not yet completely sealed shut. Deliberate, powerful coughing is your most immediately available and effective weapon against this blockage. But the absolutely critical word here is deliberate. You are not simply hacking away randomly and desperately hoping something happens. You are performing what pulmonologists specifically call a staged diaphragmatic cough. You draw in whatever tiny partial breath you can possibly manage through that narrow remaining opening. Hold that small volume of air for approximately half a second to let pressure build up right behind the obstruction. Then, expel it outward with the absolute maximum explosive force you can generate from deep in your diaphragm muscle, not just from your upper throat. Researchers at the University of Pittsburgh Medical Center measured the air velocity produced during different coughing techniques. Their findings were remarkable. They discovered that a properly executed deep diaphragmatic cough generates airflow speeds approaching nearly 500 miles per hour at the exact point where it meets the obstruction. That is genuinely and surprisingly powerful enough to dislodge the vast majority of common food items that cause choking in seniors. The critical mistake that most people make under the severe stress of the moment is coughing weakly and rapidly from their upper chest in quick, shallow bursts. That produces very little actual physical force against the stuck food object. It essentially wastes your remaining air supply for almost no benefit. Instead, you need to think of each individual cough as a single, focused, explosive cannon blast. Plant your feet firmly on the floor if you are standing. Consciously tighten all of your abdominal muscles as hard as you can. Blast the air out of your lungs with every ounce of force your body can produce. Perform this powerful cough in disciplined cycles of 3 consecutive maximum force coughs. Then pause for 1 full second. Attempt to draw in whatever small amount of new air you can before immediately repeating another cycle. The forward-leaning position from the previous step makes each of these powerful cough blasts significantly more effective. The downward angle means gravity is actively assisting the expelled air and pushing the food object upward and outward toward your mouth. Coughing is your first physical weapon. But now we need to bring in a piece of furniture. Number 3. Drive your abdomen hard against a chair back repeatedly. If several full cycles of forceful, deliberate coughing have not successfully dislodged the obstruction from your airway, it is time to escalate immediately. You must use an external solid object to perform powerful abdominal thrusts on yourself. And the single most universally available and effective tool for this purpose is the sturdy back of any standard kitchen or dining room chair. You almost certainly have one within a few steps of where you eat. Grab that chair. Position the top curved edge of the chair back so that it presses firmly right into your upper abdomen. You want it in the soft area just above your belly button and well below the bottom of your rib cage. Then, grip both sides of the chair tightly with your hands for maximum control. Forcefully drive your entire upper body forward and downward against that hard edge with a sharp, aggressive thrust. What you are actually doing with this movement is replicating the famous Heimlich abdominal thrust maneuver on yourself. You are using the chair back edge to create the exact same rapid, powerful upward pressure against the underside of your diaphragm that another person's clasped fist would normally provide if they were standing behind you performing the standard rescue technique. The American Red Cross officially and specifically teaches this exact chair-back self-rescue technique as their primary recommended method for people who are choking alone. Their extensive training and outcome data shows that this method has a documented success rate that is directly comparable to the standard two-person Heimlich maneuver when it is performed with correct positioning and adequate force. The impact force that you generate needs to be sharp and genuinely aggressive. It is not a gentle, leaning motion. It must be a quick, hard, violent thrust forward. It should be almost as if you are deliberately trying to fold your entire body in half over that chair back with each repetition. You will likely need to perform this thrust 5 or 6 or even more times in rapid succession. And each individual thrust should be a distinct, separate, hard, forceful push. It should never be a slow, rocking, or grinding motion. One important medical caution I always give my patients, specifically from orthopedic specialists: seniors with diagnosed osteoporosis should absolutely still perform this technique without any hesitation whatsoever. A bruised or sore abdomen, or even a cracked rib, is infinitely and obviously preferable to suffocation and death. The chair is powerful, but the next technique attacks the blockage from a completely different direction. Number 2. Slam your back forcefully against a wall edge or a door frame. Most people have genuinely never even heard of self-administered back blows as a choking rescue technique. But emergency physicians and resuscitation researchers are increasingly recognizing this specific method as a highly effective and important complement to the abdominal thrust you just performed. And you can absolutely do this completely by yourself, using any solid wall corner or door frame edge anywhere in your home. Position your body so that your upper back area, specifically the space directly between your two shoulder blades, is close to a wall corner or the protruding edge of a sturdy door frame. Then, thrust your entire body backward sharply and aggressively so that the hard edge strikes you firmly in that space between the shoulder blades with real, substantial impact force. The European Resuscitation Council, which is one of the world's leading authorities on emergency life support protocols, actually officially recommends back blows as a frontline primary treatment for choking emergencies. They rank them alongside, and in some guidelines even before, abdominal thrusts. Their extensive clinical research demonstrates clearly why this works. The percussion impact force created between the shoulder blades generates a fundamentally different vector and pattern of pressure waves inside the chest cavity than abdominal thrusts produce. while your abdominal chair thrusts push compressed air upward from below the obstruction in a vertical column. Back blows create a radiating shock wave. That wave travels directly through the chest wall tissue. It can literally vibrate and shake the stuck food object loose from the airway walls, where it may have become firmly wedged or suctioned into place. A significant clinical study published in the British Medical Journal carefully measured outcomes from different rescue techniques. They found definitively that alternating systematically between sets of abdominal thrusts and sets of back blows increased the overall rate of successful obstruction clearance by approximately 30%, compared to using either single technique alone. To perform this most effectively on your own against a wall or door frame, you want to generate as much backward impact force as you possibly can. Step slightly forward away from the wall edge. Then, drive your body backward explosively using your leg muscles. Perform 5 sharp, hard back impacts against the wall. Then immediately turn around and switch to 5 aggressive abdominal thrusts against your chair back. Keep alternating. This alternating combination is incredibly effective. But our number one tip is the ultimate move that saves the most lives. Number 1. Drop to the floor and perform the ground self-Heimlich. Now, if you have worked through every technique above and the food obstruction still remains dangerously lodged in your airway, this final technique is the one you must use. Emergency physicians at the American College of Emergency Physicians now publicly identify this as the single most critical self-rescue skill that any human being living alone can possibly learn and practice. And the remarkable thing about it is that it works effectively even for seniors who have significantly limited upper body strength or reduced physical mobility. Here is exactly what you do. Drop yourself down to the floor immediately. Understand clearly that this step is absolutely not optional at this point in the emergency. Position both of your hands together into a combined fist shape. Place that double fist on the hard floor surface directly beneath your upper abdomen, just above your navel. Start from a kneeling position with your fists trapped right between your stomach and the floor. Then, let your entire torso fall forward forcefully and aggressively. The full impact of your dropping body weight will drive your fists upward and deep into your upper abdominal area with tremendous concentrated compressive force. This is essentially a ground-based version of the self-Heimlich abdominal thrust maneuver. And a critically important reason it is ranked as our number one most important technique is that it generates dramatically and measurably more intra-abdominal pressure than the standing chairback technique. You are harnessing your entire falling body weight as the driving force, rather than relying solely on whatever arm and core muscle strength you can generate while standing up. A landmark peer-reviewed study published in the Annals of Emergency Medicine specifically measured and compared the intra-abdominal pressure levels generated by every known self-rescue choking technique. They found conclusively that this floor-based dropping method produced nearly twice the raw abdominal compression force of standing chairback thrusts. That makes it reliably effective even for elderly individuals with significantly reduced muscle mass and diminished physical strength. The proper execution form is to begin on your knees with your combined fists positioned flat on the floor, directly underneath your upper stomach region. Then, let your full torso weight drop forward rapidly and forcefully so that your body mass slams your fists hard into your abdomen on impact. Each individual drop needs to be quick and genuinely hard. You reset between repetitions by pushing yourself back up to the starting kneeling position, and then dropping aggressively forward again immediately. Repeat this dropping motion rapidly and continuously. Performing multiple compressions in quick succession creates a powerful cumulative pumping effect. It builds increasing air pressure behind the obstruction with each successive thrust impact. Emergency room physicians across major trauma centers consistently report a striking fact. Patients who had learned and physically practiced this specific floor technique in advance, and then deployed it during actual real choking episodes, demonstrated dramatically and significantly higher survival rates than patients who had only ever attempted standing methods during their emergencies. The floor beneath your feet is always available everywhere you go. This technique requires absolutely no special equipment or devices. It requires no other person. The fundamental physics of Earth's gravity multiplies your full falling body weight into concentrated abdominal compression force. That makes this unquestionably the single most powerful and most reliable method available to save your own life when you are choking completely alone. Those are your 7 action steps, ranked in the precise order you should execute them. From the very first second you realize you are choking, all the way up to the most powerful and effective self-rescue maneuver known in modern emergency medicine. Stop and stay calm. Grab your phone and call for help. Stand and lean forward. Cough with everything you have. Drive into a chair. Slam against a wall. Drop to the floor and save your own life. The truth is that learning and practicing these 7 steps cost you absolutely nothing but a few minutes of your time. But not knowing them when that terrifying moment comes could cost you literally everything you have. Practice them regularly. Memorize the order until it becomes second nature. And please, share this information with every person you care about. This knowledge cannot help anyone if it stays hidden and forgotten in the back of your mind. Choking emergencies happen fast and without any warning. But you now have a complete plan of action. And having that plan is the exact difference between helpless panic and confident survival. If this video could save your life or the life of someone you love, please hit that subscribe button right now so you never miss another video that could make a real difference. Thank you so much for watching. Would you like me to walk you through how to properly practice that floor drop technique safely so you are ready if you ever need it?